Hey everybody, welcome to my channel, and in today's video I'm going to be answering the question why your child puts everything in their mouths. So the number one reason why your baby or your child is putting everything in their mouths is because it's normal. Oral seeking is actually a typical part of development depending on the age of your child. So if you think about it, babies often use that sucking motion to feed, whether it's breastfeeding or bottle feeding. You may even notice that a lot of babies use pacifiers or may suck their thumb, and that's because it's calming or a self-soothing mechanism for them. In the first few months of a baby's lives, you will rarely see them truly exploring objects with their hands or with their fingers. And that's because that part of their body is not quite developed just yet. But their mouths is something that they have been using since they were born, especially to feed and to nurse. So as they continue to grow, they continue to rely on their mouths because this is something they've known since birth. And now they will start to use their mouth to explore their environment and the world around them. So when a baby is using their mouth to explore, it's almost as if they have a second pair of eyes. They're using their mouths to observe, how big is this object? Or is this hard? Is this soft? What does it taste like? Is it something that's good? Do I like it? What's the shape of this? So they're answering so many questions in their little brain of theirs just by using their mouths. You will typically see babies and children mouth and put things in their mouths to explore all the way up until around the age of 2. And just because they turn 2, it does not mean that there is an automatic switch in which they're just going to automatically stop putting things in their mouths. But you should actually start to notice a decrease in the frequency or the intensity of how often they're putting those things in their mouths around the age of 18 months to around the age of 2. And after the age of 2, it should start to definitely dwindle down to where you don't see it as much, because now they should be using their hands and their fingers a lot more to explore their environment. So if you notice that your child is over the age of 2, but they're still putting all these things in their mouths and having a lot of these oral seeking behaviors, it could actually be for other reasons. So another reason why your child may be actually putting things in their mouths after the age of 2 is because it's self-soothing for them. Children are not quite like adults. If they find something that works, they often stick to it. So if their whole little lives they've been using their mouths as a way to self-soothe and calm down, even after they turn 2, it may be the same strategy that they go to. Another reason why your child may still be putting things in their mouths if they're over the age of 2 is because they may be experiencing some type of sensory overload. So if there's too much going on in their environments, too much noise, too much sound, too much lights, or they're just overwhelmed or anxious, putting things into their mouths or mouthing things may be a way that they're trying to have some control over everything that's going on around them, and it may be a way for them to actually calm themselves down. Another reason why your child may be still putting things in their mouths is because there could possibly be some type of developmental delay. So just because your child is chronologically the age of 2 does not necessarily mean they are developmentally the age of 2. And for a child who is not developmentally at the same age of where they are chronologically, that could mean that, hey, it may be appropriate that they're still putting things in their mouths based on where they are at personally in their developmental stage. It's also very common for kids to put things in their mouths if there is some type of issue going on with the mouth. So teething is very common. It's a very common reason as to why kids still put things in their mouth. They may be trying to soothe the pain of their teeth growing in by mouthing things. Or there could be an infection or some type of decay going on. So if this is something that you see your child doing quite often, it may not hurt to actually seek professional help and maybe even have your child go to the dentist just to make sure there is not a medical reason that your child is doing this. And speaking of medical reasons, another reason is some children may have a medical condition called Pica. And with Pica, kids not only just mouth toys and things like that, but they also may be mouthing some very non-edible objects or things such as dirt or chalk or tissue. They may like cigarette butts or just things that are like, gross. But these are things that they may actually crave and really seek out to put in their mouths. And this could be due to a nutritional deficiency. So if you're seeing your child really chew and eat and try to put things in their mouths that are really non-edible or gross or could be dangerous for them, definitely seek out a pediatrician so you can get them tested for the possible underlying reason of pica. So if you've been following along and you're wondering, well, what are some strategies that I can do in order to help my child who is oral sensory seeking? Well, definitely watch this video that I'm going to put right here, and I'm gonna also put in the link in my bio below. Click that video because in that video, I'm going to be sharing with you and demonstrating some strategies that you can use to help your child with their oral seeking needs. Don't forget to subscribe and hit that notification bell so that you know exactly when I post my next videos. Thank you guys for watching, and I will see you all on the next one. Bye.